Now I would like to share with you how partnering with Unitec Learning can help you build a talented team and keep them longer. During the presentation, if you have any questions, enter them in the chat feature and they will be answered at the end of the presentation. First, I would like to provide you with an overview of Unitec Learning. Unitek leverages over 25 years of experience to offer relevant, dynamic, real-world nursing and allied health education to help students and healthcare organizations achieve their goal. Unitek has 19 campus locations in 6 states, in Arizona, California, Nevada, Utah, Idaho, and New Mexico. We offer a variety of master's, bachelor's, diploma, and degree-level programs in healthcare and allied health. We have a proven track record of providing value to hospitals through our partnership program, which creates a pipeline of qualified practitioners ready for hire. By partnering with us, you will gain full access to healthcare workers that other colleges cannot match. You will tap into our consistent pipeline of medical assisting, licensed vocational nurses, bachelor's, and master's prepared nurses. Then leverage our broad portfolio of academic programs to train, upskill, and even reskill your existing team. At Unitek, we are focused on reintegrating healthcare education with the hospital environment to combine the rigor of a university education with the workforce development needs of healthcare institutions. We look at this as a way of reviving the best of the diploma programs that existed in the past and which Rain alluded to in his presentation. The combination of a high-quality university education and the practical knowledge necessary to thrive in a hospital will result in shortening training time, and nurses will be ready to practice day one. Now, I would like to share with you some solutions that we have developed based on the knowledge we have gained from our clinical partners and our advisory boards. Our Microeducation Center, or also known as School in a Box, brings nurse training back to healthcare facilities. We leverage your expertise in hospital operations and our core competency of educating culturally competent and caring nurses. We supply CCNE accredited nursing education to a microeducation center at your facility. And we make it a priority to select local community members to participate in the program. Our rural partners have indicated that this model has been very beneficial in attracting new nurses to their locations and retaining them. Our next partnership model is our PRN, Practice Ready Nurse Program. We spend time gathering information from our clinical partners, and they shared with us that some of the most pressing pain points in workforce solutions are related to new nurse training and the high rate of turnover. But what if onboarding could be shortened and turnover reduced? Our Practice Ready Nurse Program precisely accomplishes that by shifting onboarding to a pre-hire timeline and instilling your unique culture sooner. Your organization can be more efficient and effective. And the program also helps reduce burnout and turnover by helping new nurses understand your organizational priorities before they're hired. Mission Alliance and Excellence in Training is the nature of partnership collaboration, and it is infused in all of our partnership programs, and it can change the fabric of the communities we serve while helping you achieve thriving healthcare workforce. As a Unitec Learning partner, we will use this approach to solve your work shortages with employees who are ready to improve patient outcomes from day one. Please submit any of your questions in the chat box and we'll go ahead and answer those. I just received one question from our studio, and it states, does it cost anything to partner with Unitek? And the answer is no. Basically, the main thing is to reach out, and my contact information is on this slide, so you can either reach me either email or phone, and we can go ahead and set up a time to discuss how we can create a workforce solution that will work for your institution. I have one more question regarding how do you find out more about School in the Box? Um, the School in the Box, again, it's the micro centers where we go to you and your facility and develop a unique way of creating a pipeline of new nurses for your facility. And you can go ahead and go to partnership@unitec.com and email me so I can provide you further information. Another way is checking out our website, and under partnerships, you will find some general information. Let's see here, we have another question that just came up, and it's from Ludmina Gomez. Can an LVN join the PRN program? That's an excellent question. So yes, an LVN can go ahead and join the PRN program. It would just depend on whether we're partnered with the facility that you're working or you wish to work, and see if we do offer that PRN program, and then you would be able to qualify, potentially qualify and apply to join it. Another question that just came in is, can a partnership be developed regardless of location? That's an excellent question. As I mentioned earlier in the presentation, we do have, we're located in 6 states, and we have over 19 locations in those states. However, that's the goal of the School in the Box and the micro centers, is to be able to go ahead and go to rural communities that perhaps don't have access to a school. And again, we can collaborate in developing that right there at that location. So location is definitely something that we can explore and collaborate on and find out if it's something that would be feasible to bring the School in the Box to you. Let me check if there are any other questions. Okay, there are no more questions, but again, please jot down this information that's on the screen so you can learn more about partnering with Unitec Learning. And now I encourage you to visit our exhibitor booth to learn more about our partners. And also, don't forget the networking center to meet up with your colleagues and make some great connections. Also, please be back in the main auditorium at 12:45 for our last session with Dr. Abdel Yosef, our Chief Academic Officer. Thank you very much for your time today, and I hope you enjoyed the symposium.